have students in visualizing anatomy. It's a course that's co-taught by a visual artist and an anatomy faculty member. And what students are doing is they're practicing visual art exercises that reinforce what they're learning in the anatomy classroom. Jefferson requires, as part of its new curriculum, first-year med students and second-year med students to take humanities selective courses. And those reinforce key skills related to doctoring. Close observation, really learning how to see, listening, appreciating patient perspectives, understanding one's own emotions and the emotions of other people, and that self-care piece, understanding when burnout might be approaching.
So I hope it will increase my creativity for patients in the clinic. I think that it will really help me, hopefully in the future, do the same for my patients.
I like it because it's a new way of looking at the material we already learned. So we learn the material through like the science lens, but it's nice to learn it through the art lens as well, and it kind of adds something. It helps you understand it a little better. Just having those visual and spatial skills is definitely helpful, and then just like learning how to look at a system and be able to visualize it in a 3D kind of way will really help me, and that's a skill that I'm learning through this class.
I think it's great. We definitely get to some exposure with like radiographic images and CT scans, and again, just like your traditional gross anatomy, and just get to spend more time with being able to see the differences, and by looking at it through an artistic context, it makes you really appreciate different aspects of it that you wouldn't have done if you were just thinking about it from a medical lens. So in the visualizing anatomy portion of it, you get to sort of manipulate your environment in a way that makes those tools more applicable to whatever you're trying to see.
Well, I think a lot of what it takes to be a good physician incorporates the senses that you hone in visual arts. When we try and recreate different parts of the body, you need a very fine-tuned attention to detail. It's almost like teaching someone about an organ, except you need to know exactly where everything is so that you can recreate it. And so I've found that when I am participating in the class, there are certain things that I thought I knew from studying that I realize I actually don't have as strong enough of an understanding as I would like in order to be able to recreate it. So I think that attention to detail is definitely something that you practice here that is important as a physician.
I believe that creativity is the least talked about and most important skill set that doctors need. Because the ability to win in a new healthcare system is going to be able to think about things differently. And when you think about it, being creative allows you to be bold and think differently and take risks at a totally different level. If things are changing around you and you're a creative person, you're going to believe that you're going to succeed because you'll come up with that idea. Less burnout, better results.